सांस की खराबी से मुराद ऐसी हालतों का एक ग्रुप है जो निज़ाम तनफ़ुस को मुतासिर करता है, जिसमें फेफड़े, सांस की नाली, बरूनिकी और alveoli शामिल हैं। कुछ आम सांस की खराबियों में दमा, दायमी रुकावट, फेफड़ों की बीमारी, न्यूमोनिया, ब्रोंकाइटिस और फेफड़ों का कैंसर शामिल हैं। सांस की खराबी की अलामात में सांस लेने में दुश्वारी, घरघराहट, खांसी, सीने में तंगी और सांस लेने में दुश्वारी शामिल हो सकती है। वो मुख्तलिफ अवामिल की वजह से हो सकते हैं, बशमूल इन्फेक्शन, माहौलियाती जहरीले मादों की नुमाइश, तंबाकू नोशी की वजह से हो सकते हैं।
Respiratory disorders refer to a group of conditions that affect the respiratory system, which includes the lungs, trachea, bronchi, and alveoli. Some common respiratory disorders include asthma, chronic obstructive pulmonary disease, pneumonia, bronchitis, and lung cancer. Symptoms of respiratory disorders can include difficulty breathing, wheezing, coughing, chest tightness, and shortness of breath. They can be caused by a variety of factors, including infections, exposure to environmental toxins, smoking, and genetics. تشير اضطرابات الجهاز التنفسي إلى مجموعة من الحالات التي تؤثر على الجهاز التنفسي، والتي تشمل الرئتين والقصبة الهوائية والشعب الهوائية والحويصلات الهوائية. تشمل بعض اضطرابات الجهاز التنفسي الشائعة الربو ومرض الانسداد الرئوي المزمن والالتهاب الرئوي والتهاب الشعب الهوائية وسرطان الرئة. يمكن أن تشمل أعراض اضطرابات الجهاز التنفسي صعوبة التنفس والصفير والسعال وضيق الصدر وضيق التنفس. يمكن أن تكون ناجمة عن مجموعة متنوعة من العوامل، بما في ذلك العدوى والتعرض للسموم البيئية والتدخين وعلم الوراثة. This Etsy web page advertises a digital respiratory disorders study guide created by the Printable Plus. It is designed for nursing students and covers topics such as respiratory disorder approaches, commonly prescribed treatments, and potential problems related to patient support. The guide is available as an instant download in PDF and PNG formats, focusing on respiratory conditions like asthma and cough. تعلن صفحة الويب الخاصة بTSC عن دليل دراسة اضطرابات الجهاز التنفسي الرقمي الذي أنشأته The Printable Plus. إنه مصمم لطلاب التمريض ويغطي موضوعات مثل مناهج اضطرابات الجهاز التنفسي والعلاجات الموصوفة بشكل شائع والمشاكل المحتملة المتعلقة بدعم المرضى. الدليل متاح للتنزيل الفوري بتنسيقات PDF و PNG، مع التركيز على أمراض الجهاز التنفسي مثل الربو ومرض الانسداد الرئوي المزمن.
On
Right.
Etsy.
See?
Yeah, Etsy.
Wow.
It's kind of amazing. Makes you wonder, like, who buys study guides on Etsy? And what does that even tell us about, what they need to know about breathing problems?
Well, I think it's really fascinating. It gives us sort of a window into the practical side of these disorders. It's not just about the biology, it's about how people are actually like dealing with these conditions in their daily lives.
That's so true. It's like a real world perspective.
Exactly.
So, okay, this Etsy listing may not be like a fancy medical textbook,
Right.
but I think it's going to be a treasure trove of insights into what's considered essential knowledge about respiratory disorders.
Definitely.
Let's dive in. First things first. What exactly are respiratory disorders?
Well, the listing defines them as a group of conditions that affect the respiratory system, which includes your lungs, the trachea, the bronchi, and the alveoli. So think of it like this. Your respiratory system is kind of like this delicate network of pipes and balloons,
Okay.
delivering oxygen to your body and removing carbon dioxide.
Right.
So when any part of the system malfunctions, you've got a respiratory disorder.
Okay, that makes sense. So if your pipes are like narrowed by inflammation or your balloons can't inflate properly,
Right.
that's when you start having problems.
Exactly.
What kind of problems are we talking about here? What are some of the common respiratory disorders?
Well, the listing mentions a few that you probably already know, like asthma, COPD,
Right.
pneumonia, bronchitis. It even includes lung cancer in there.
Oh, wow. Okay. So that's a pretty wide range from chronic conditions like asthma and COPD to acute infections like pneumonia
Exactly.
and lung cancer. That's a whole different story.
Definitely.
So what kind of symptoms should people be on the lookout for?
Well, all the usual suspects are there. Difficulty breathing, wheezing, that horrible tightness in your chest, and of course, coughing. But, think about what those actually mean for someone's life. Like, imagine struggling to catch your breath just walking up a flight of stairs. It can be totally debilitating.
It's true. We take breathing for granted.
Yeah.
It's easy to take you for granted until you can't do it easily.
Right.
And yeah, you're right. Those symptoms would impact just about every single aspect of your life.
Yeah, absolutely.
And I noticed this listing even mentions patient support and making report or prints, which makes me think it's maybe geared toward nurses or other healthcare providers.
That's a great observation. It seems like the study guide isn't just about, understanding the diseases themselves,
Right.
but also about the practical skills nurses need to, actually care for patients with these conditions.
Wow. So it's a window into the world of respiratory nursing.
Exactly.
That's so cool. Not just the illnesses, but how nurses deal with them.
Absolutely.
So what causes these breathing problems in the first place?
Well, the listing points to a bunch of different things. Infections, environmental toxins, smoking,
Right.
and even your genes.
So it sounds like it could be a single cause or a combination of factors.
Right, exactly. It's often a complex interplay of things.
Can you give us an example? Like, how does that work in real life?
Sure. Imagine this. You might be genetically predisposed to asthma,
Okay.
but you never actually develop it unless you're exposed to certain triggers, like air pollution or pollen.
Oh, interesting. So it's like it's a delicate dance between nature and nurture.
Exactly.
So even if you have like bad genes, you might be able to avoid getting sick if you just avoid the triggers.
Exactly. And that highlights how important it is to understand those triggers and take steps to minimize your exposure.
That's a good point. So let's talk about treatments. The listing mentions medication, therapy, and even surgery. But it really seems to zero in on respiratory disorder approaches and commonly prescribed tools. Why do you think that is?
Well, I think for nurses, it's not enough to just know what a disease eye is. They need to know how to actually care for patients experiencing it.
Right, of course.
So that means, being familiar with the common treatments, what to watch out for, and how to support patients through it all.
So it's all about practical application, not just theoretical knowledge. This study guide's basically a crash course in, Respiratory Nursing 101.
Exactly. It's giving them the tools they need to actually do the job.
This is so cool. We're not just learning about respiratory disorders, but we're learning about how nurses learn about them. It's like a meta deep dive.
I love that. It shows how diverse knowledge can be. Sometimes the most insightful information comes from the most unexpected places.
All right, before we go any further, I'm curious. What's jumping out at you so far about this whole Etsy study guide thing?
What's striking me is how this simple study guide really highlights the intersection of healthcare and everyday life.
Yeah.
We're not just talking about these abstract medical concepts.
Yeah.
We're seeing how those concepts translate into actual care and decision-making.
Totally. It's like we've stumbled onto this secret decoder ring for understanding the world of respiratory nursing. Now let's get back to those treatments. The listing mentions medication, therapy, and surgery, but it really seems to hone in on commonly prescribed medications. Any thoughts on why that might be?
Well, I think it's about practicality. Nurses need to be up to speed on the medications that patients are most likely to be taking.
Right.
Which means knowing dosages, potential side effects, and how to administer them safely. It's all about that frontline, hands-on experience.
So it's less about the science of the drugs themselves and more about how they're used in a real-world